and not likely until 2021. Natalie Brand, CBS News, the White House.
Health leaders in Chesapeake are taking action to help minorities and others in underserved communities find out if they have COVID-19. News 3 reporter Margaret Cavanaugh is in South Norfolk to demonstrate what happens when you get tested.
The parking lot at the Food Lion in South Norfolk has been turned into a walk-up clinic. You go up and fill out a form asking you about your personal information and if you have any symptoms. Health department officials say you don't have to have any symptoms to get tested, as there are many people that are asymptomatic. I don't have any symptoms and took the test anyway.
It goes at both nostrils. It goes pretty far back for about 15 seconds each.
They put a swab up each nostril for 15 seconds. It's not the most pleasant experience, but it's done pretty quickly. Health department officials say they're looking at data and determining where to set up their free testing sites.
We are interested in doing extensive testing, and we want to do it in areas where there are primarily minority populations, because those are a high percentage of positivities, and there are high percent of folks who are ending up in the hospitals.
And it's not just free testing. They're providing educational information, interpreters for people who don't speak English, and ways to sign up for Medicaid.
We have tested over 6% of the Chesapeake population. Our percentage of positivity is a little over 5%, but in the African American and the Latino population, it's higher.
Dr. Nancy Welsh is the director of the Chesapeake Health Department. She says she wants to reopen, but wants it done protectively, fearful for an increase in the number of cases and deaths.
We can do it, mask. It's an easy enough thing to do. Physical distancing is an easy enough thing to do. And then we can open it up safely.
You know, our concern is that people get the care they need and that they do come to the hospital when it's needed. And that's why we want to get out in the community and let folks be tested and know that they may be facing this potential virus. We hope that everyone's exercising the precautions. We certainly have a close eye on the numbers.
We don't have medicine, we don't have vaccine. What we have is each other.
I'm Margaret Cavanaugh for News 3.